Hey, family, this is Shannon Jackson, the People's Nurse. Thank you for tuning in to another episode of Living Your Life Without Limits. And I will be discussing today with none other than Dr. H. Hutson, board certified physician, talking about lipid protein LPA. This is an important lab result related to cardiac disease. Stay tuned, you don't want to miss it.
Wake up, everybody, let's elevate your mind. Live your life without limits, no more wasting time.
Okay, ladies and gentlemen, please join me with a heartfelt welcome to none other than Dr. Hutson. Dr. Hutson, thank you for joining Living Your Life Without Limits. How are you today, sir?
I'm very well today, and I'm glad to be here to join in on all of the good things that you've been doing.
Well, thank you so much. It's an honor to have you here today. And I know you're new to the podcasting area, and thank you so much for allowing us to be a part of this new journey you're taking on. So, this is a very good subject matter that we're going to be talking about today. And many of the viewers and listening audiences that tune in to Living Your Life Without Limits is not familiar with this. And you and I had some conversations before, and we want to talk about this. So today we're going to be discussing again about lipid protein LPA and why these numbers matter. Talk to us about this. What is it for those that don't know anything about it?
Thank you for that introduction. Well, first of all lipids are made in the liver, and lipoprotein A, like your LDL or bad cholesterol, and your HDL, your good cholesterol, and your very low density lipoprotein are all made in the liver. And believe it or not, um, you don't need to eat any foods that contain cholesterol. Your low density lipoproteins, your high density lipoprotein all contain cholesterol. 75% of all of your cholesterol is made by the liver. 25% of the cholesterol is ingested in the foods that we eat, particularly meat, dairy, and highly processed foods. Lipoprotein A is also another lipid that's made by the liver. It was actually discovered in 1963. Now, your LDL cholesterol, try to bear with me, I'm going to go slow. Your LDL cholesterol sends food to different cells of the body. It sends vitamins, minerals, and it also sends fat cells to the cells of the body. Your HDL, your quote, a good cholesterol, removes some of that LDL from your arteries. And the reason why it moves that LDL from the arteries is LDL is a little bit sticky. And because it's a little bit sticky, guess what? It sticks to the arterial cell wall. HDL removes that and takes it back to the liver, so it doesn't do that. Now, let's talk about lipoprotein A. Lipoprotein A, no one actually knows exactly what lipoprotein A actually does. It's assumed that what lipoprotein A does is it helps to repair damaged cells. It takes vitamin C, minerals, and fat and other nutrients to these areas. The difference between LDL cholesterol and your lipoprotein A is lipoprotein A has an additional protein, an apoprotein, and that apoprotein makes it even stickier to your arterial cell wall. In fact, lipoprotein A is 6 times more atherogenic. In other words, it would cause atherosclerosis six times more aggressively. It accelerates atherogenesis in the arterial system. That's really one of the big problems with lipoprotein A.
So let me ask this question. In knowing that, why isn't this part of the basic cholesterol labs? Because I don't believe right now that that's the basic test that's being incorporated in many people that go and get labs done all the time.
Okay,
So, I mean, mhm.
that's a good question. Well, number one, lipoprotein A was discovered in 1963 by a scientist in Europe. And uh, there's no medication that you can take for an elevated lipoprotein A at the present time that's FDA approved. No medication, but we'll come back to that later. And because there was no medication for it, and because no one knows what it does, no one knew how to treat it. For example, if you have an elevated LDL cholesterol, and you're taking a statin, that's going to increase your lipoprotein A by about 10 to 15%. People don't know that. It increases your lipoprotein A. So your lipoprotein A peaks at about 5 years of age. So if you have a 5-year-old or a 6-year-old, if you you can check their lipoprotein A at that age, and you'll know whether or not it's normal, or you'll know whether or not it's elevated. Does that make sense?
It does, but on that vein, most of the people, they're putting them on statins.
Exactly, because you have more LDL particles in the blood than you have lipoprotein A in the blood. So because you have more LDL particles in the blood than you have lipoprotein A in the blood, the amount of LDL is going to accumulate more than your lipoprotein A. You see what I mean?
Okay.
So
Yeah.
so therefore, people have been focusing mainly on the LDL. But now what people are beginning to see, you still need to focus on the LDL, but you have to focus on lipoprotein A. That should be a major focus now. And one of the things I should probably mention is about that 1.4 billion people in the world have an elevated lipoprotein A. 68 million Americans have an elevated lipoprotein A. 16
And
million African Americans have an elevated lipoprotein A. 16 million.
wow, that's a very high number, because that was just what I was getting ready to ask you. Is typically when it comes to cholesterol, African Americans and Hispanics by far are more at risk for cardiovascular diseases, right?
Right.
So, with these numbers being this alarming, are you seeing the medical institutions and organizations beginning to incorporate this lab test as one of the basic things that we need to be looking at?
So the answer to the question is no. They should be, but the answer to the question is no. Now, only 1% of people in the United States have ever been tested for lipoprotein A, less than 1%. And and if you figure that overall less than 1%, you can imagine for African Americans, it's even lower, a lot less than that 1%. So one of the things that we know that you're going to get, or you can get from atherosclerotic cardiovascular disease, is one, sudden death; two, you can have a heart attack or myocardial infarction; three, stroke; four, aortic stenosis; five, um, peripheral vascular disease, where you can lose fingers, well, not fingers, but toes, your foot. And the other thing is you can have a AAA, an abdominal aortic aneurysm, from that. And science is now beginning to show that you can even get kidney disease from having the atherosclerotic cardiovascular disease as well. So now that you know that you can have all of that from high LDL cholesterol, think about if you have lipoprotein A, it accelerates that. It accelerates that. It accelerates that uh, by 6 times what LDL would actually do to your arteries and to the rest of your body. So it's a very serious lab that everyone should have. In Europe, everybody is tested at least once, everybody.
So I don't mean to cut you off. So you mean to tell me Europe is testing everyone at least once?
Hmm.
And this has been going on for how long
Honestly, I
in
can't
Europe?
say, but I would say for at least 5 to 10 years or more.
And in the United States of America, you're saying most of us have never ever received this test at all.
No, no, they haven't.
And why is that so, with so much emphasis on cardiac conditions? And then you have organizations like the American Heart Association and various different institutions and cardiologists. Why is this not a push? Is it a cost to the test being so expensive, or is it just purely a lack of knowledge or dismissal of research data, or a combination
I
of all
think I
three?
think it's a combination of all of the things that you pointed out. I don't, I think it's a combination of all of those things. However, it's not an expensive test. It may cost an additional $25, but it's not expensive. You could easily add lipoprotein A to your lipid panel. Easily, that can easily be done. So there's no reason to not to add it to that lipid panel. And I personally think that anybody that has, well, it's too late if you have sudden death, of course, but if you have an MI or heart attack, stroke, peripheral vascular disease, aortic stenosis, um, atrial fibrillation, congestive heart failure, all of those people should have an lipoprotein A test, because it may not be from the just straight from just cardiovascular disease itself as we've seen it, or LDL. This could be totally from having that elevated lipoprotein A. The most important point is this: if you could catch somebody very early with an elevated lipoprotein A, and they modified their diet, you know, they exercise, they decrease their saturated fats, um, they, just did more appropriate lifestyle changes. You could even with a high LPA, you could decrease the possibility of them having a catastrophic cardiac event by 66%.
So the treatment options or the management options are the same in essence,
Well, there's
because
only one FDA-approved treatment for lipoprotein A, and that's apheresis. And it's no different. That's similar to um, um, dialysis, like how people go to
yes,
dialysis for, it's similar
yes.
to dialysis where they wash out your high LDL, they wash out a lipoprotein A, they remove about 80% of it. The procedure takes anywhere from 1.5 to 4 hours, just like dialysis, but that procedure is $2,500 to $3,000 each event. And most people have to go either usually go minimally twice monthly, sorry. So they minimally go twice monthly to be able to have that done. So it's extremely expensive. So that's not what's going on now. So what you
But
see, go ahead.
but from a prevention point, for us as consumers, people, just regular everyday people, because the show is about motivation, education, and
Okay.
inspiration,
So,
and we want to look at prevention. What can the person listening, the listening viewer, or the
okay.
being proactive in their own care, that doesn't
Okay.
change, right?
Okay. So number one, you can't prevent your LPA. Number one, it's genetic.
Okay.
Um,
Okay.
and I think that everybody should be tested, and particularly African Americans should be tested. Uh, Hispanics have a 15% chance of also developing, having a high lipoprotein A as well, not just African Americans. And also Southeast Asians also can have an elevated lipoprotein A relative to other races and other people in the world. Um, but the big thing is genetic, it's autosomal dominant. And let's say, for example, if you test yourself and you have an elevated lipoprotein A, there's a good chance that 50% of your children, if you have, let's say, 4 children, 2 of those 4 children are going to have an elevated lipoprotein A. So you should also have your children checked for your lipoprotein A as well. Now, prevention, let's keep going in that direction. Well, if you know you have a elevated lipoprotein A, and let's say you have high blood pressure, let's say you have diabetes, let's say you have high cholesterol, you need to focus on getting all of those things under control. That should be the first thing you should do. You got to get your blood pressure under control. You have to get if you're diabetic, get your sugar under control. Uh, and if you have high cholesterol, make sure you're taking your statin, even though I've said that statins will increase your LPA by about 10 to 15%. You still need to take that statin. And remember, I said that's because you have more circulating LDL than you have lipoprotein A. So you want to get those things under control. And the big thing is, I think you should really do is lower your saturated fats, right? And you lower your saturated fats by eating a little bit less, well, not a little bit, eating less meat and less dairy and less highly processed foods. So if you do those three things, that will definitely help to lower your LDL cholesterol. And how does saturated fat affect your LDL? When you eat foods that are high in saturated fat, it blocks the liver from breaking down the LDL cholesterol. So therefore, you have more LDL cholesterol circulating in the blood. And because you have that more LDL circulating, that's more LDL, including lipoprotein A, that's being deposited in the arterial wall. And remember, both is sticky, but lipoprotein A is more stickier, and that's why you can get that blockage of blood vessels. It's like I say, somebody that has peripheral vascular disease, it may not be just from their diabetes. It could be from lipoprotein A. And so we need to take a look at that. Now, are there any medications that are FDA, that non-approved medications by the FDA that you can use? Well, yeah, you can use PCSK9 inhibitors like Repatha. Repatha will lower your lipoprotein A up to about 40%. Let's say if it's 300, right? If it's 300 and it lowered 40%, that's beneficial, but that's not getting it low enough. So there are 4 drugs coming out on the market, and I'm hoping that those drugs come out on the market by 26 or 27, and they're specifically for lipoprotein A. And they will lower lipoprotein A by about 80 to 90%. So that's really what we all got to make sure that we're here for. And we can be here for that by focusing on our blood pressure, focusing on our diabetes, focusing on our cholesterol. And we can do these things by exercise, by diet, by controlling our weight, and other things that may actually increase lipoprotein A is stress, controlling our stress. So there's a lot of different ways that we can do things to help to improve our situation if we have lipoprotein A. The earlier we find out that you have this, the better, because the earlier we can do all of these interventions.
So, as I was saying when I was talking about prevention,
Yeah,
I was referring to those very things that you mentioned. When it comes to cardiovascular disease, actually not just cardiovascular, chronic disease management as a whole, it still goes back to those same 4 things. Exercise, weight
yeah,
is a big issue. Smoking is an issue.
yes,
Stress is an
yes,
issue. Diet is an issue. And
yes.
if we continue those things and being self-conscious about helping ourselves, overall, we can reduce our risk of all chronic conditions, along with, as you said, managing our medications and things of that nature. But doubling back to one thing that you said about testing. Now, many people don't have control over what tests they can do. Now, what if a person goes to their doctor after listening to this podcast and says, hey, I want to get this test done? Sometimes being in managed care environments or other areas, not managed care, doctors don't automatically just do a test because you want a test done. So, what is it that a person can say to convince their healthcare provider, or is there other opportunities that this test can be done if they want to independently get this done? Because we're in a managed care environment now, let's be honest about it. Or we have healthcare physicians that may not necessarily be well versed or believe this is necessary. As you mentioned, they're focused more on the good and bad cholesterols, right? So they may necessarily not feel to want to do this. So, what does the person that may have concern now that they've heard this or seen this podcast do in that state? What would you advise?
I was looking for it, but I can't find it. I thought I had it here on a piece of paper. They can go online and look up Family Heart Foundation. Family Heart Foundation. And Family Heart Foundation will send you a kit for free. They will analyze your lipoproteins, including your lipoprotein A, for free. They will send you a kit. They tell you how to fill out how to give them a blood sample, just nicking your finger and put it on a smear, and you can send it to them, and they will analyze your blood for your lipoproteins, including lipoprotein A, and they'll send it back to you privately and let you know what your numbers are. No one would know but you.
I love this. We're going to put this link onto the podcast link, and we're going to put this on this show. Family Heart Foundation.
Family
I'm going to
Heart
have
Foundation.
I'm going to have
I
my
had a
team
phone
look that
number for
up.
you.
That's okay. I'm going to have my team look it up, and we're going to add this because this way I'm really big about us being active participants in our care.
Yeah,
I teach in the community. And many times when I teach the community, I tell them, you are not just a receiver. You need to be an active participant and own your ownership in the healthcare process
right.
because you can help guide your care by being actively involved and
Yeah,
understanding and informed about what you're doing, what you're taking, what precautions that will help you. So this is wonderful. I will definitely be linking this family here, right here on Living Your Life Without Limits, so that you can go after it even on your own and
right.
be able to get this test done and take it to your healthcare provider and let he or she work with you and make sure you stay as healthy as possible. As we're coming to a close, this has been very, very enlightening, Dr. Hutson. And I thank you again for being on this show and bringing this information. Being a African American female who has family that have passed on from heart conditions and diabetes and other chronic conditions, I'm all about prevention and doing what can we do to stay healthy. So on that note, I know you do a lot of private education and consultation with individuals. How can people reach you if they want to go further into wellness on their own independently? How can people reach you?
Uh, I am called Lifestyle Medicine Transformation. And what we do at Lifestyle Medicine Transformation, we work with people that have high blood pressure, type 2 diabetes, high cholesterol. We work with patients that have cancer, and we work with them on the big proponents of lifestyle medicine. The only thing that I would say about patients is come with a commitment and we'll be glad to take care of you. Come with a commitment that you are willing to do your part to get better. I promise to do my part, but I can't help you to get better unless you make a decision to do your part. So come with a willingness to want to get better on your part. And I promise you, I will do all of what it is that I can do to help you to get better because I can't help you to get better without your support. It's impossible. But the
Ab-
phone number is 310-916-9554. Again, 310-916-9554. But back to the Family Heart Foundation, just briefly, that let's say, for example, they find that you have a high lipoprotein A They will also help you find a lipid specialist that will help take care of you for your elevated lipoprotein A.
I love this. I absolutely love this. Family, you are getting free nuggets today. So if you are at risk, and many of us know we have history, genetics, as he talked about, and people that have gone on, or people in our families, or maybe ourselves that are struggling with some of these conditions. So you have some gifted nuggets that we're dropping on you today. And
Right.
as we get ready to close this episode today, any final thought that you want to leave before I do my closing statement,
I
Dr.
would
Hutson?
also like to say this is that in particular, and this is for everybody, but I want to look at death by race just real quick. Um, we spend a lot of time comparing uh, blacks to whites as far as age, as far as death, as far as blood pressure and things, but we really need to be looking at other cultures. For example, Asians in this society live to be 85 years old, rough on average, 85. And if you look at Hispanics, they live to be 82. The problem there, though, is they have severe medical complications like um, loss of an extremity from type 2 diabetes, severe heart failure, but they're still living to be 82. And if you look at whites, they on average, they live to be about 79. African Americans die younger than most. African Americans live 10 years less than Asians in this country, 10 years less. So we need to not to just be looking at comparing ourselves to whites who live to be 79. We need to look at people who are living to be 85 years old, 85.7 to be exact. Why are these people living so much longer and our death is accelerated by 10 years? So we need to relook at that. And if 18 million of us have an elevated lipoprotein A, that could be part of the reason. I mean, I think that there are other things like, right, health related things, not having health insurance, not having a doctor, not having a good doctor. There's all these racism. We all know the whole story. So, but we need to look at just our health now. We need to focus on just getting better. And we can't look at the system sometimes to help us. Sometimes we just have to look at what it is that we can do for ourselves.
Absolutely. And I want to just climax that with this. This is what this show is all about. It's about you living your life without limits. And that is taking a holistic approach, mind, body, spirit, and your health matters. Making yourself a number one priority is your first and primary job. Because if you're not here, it doesn't even matter what
Yeah.
happens after that. So, family, as I often say when I get ready to close this show, remember to love yourself, take care of yourself, because guess what? You are absolutely worth it. And that involves being an active participant in your care. I want to thank Dr. Hutson again for joining us with this new, fresh knowledge that we're bringing to our viewer and listening audience, and how something so little in cost can be a game changer in prevention.
Yeah, it's a
So
game.
thank you again, Dr. Hudson, for joining
You're
us
very welcome.
today. And I thank you, the viewers and listening audience. I am finally coming back with fresh episodes that are thought provoking, that are motivating, educating for you to continue to live your best life. And thank you once again. And I look forward to you tuning in to our upcoming episode.